Rectus sheath. It is an aponeurotic sheath covering the rectus abdominis. It has three parts, anterior and posterior. Features: anterior wall. It is complete covering the muscle from end to end. Its composition is variable as described below. It is firmly adherent to the tendinous intersections of the rectus muscle. Posterior wall. It is incomplete, being deficient above the costal margin and below the arcuate line. Its composition is variable as described below. Formation. First, above the costal margin. Above the costal margin, anterior wall, external oblique aponeurosis, posterior wall. It is deficient. The rectus muscle rests directly on the 5th, 6th and 7th costal cartilage. Second, between the costal margin and the arcuate line, anterior wall, external oblique aponeurosis and anterior aponeurosis of the internal oblique muscle. Posterior wall, posterior lamina of the aponeurosis of the internal oblique and aponeurosis of the transverse muscle. Third one, below the arcuate line, anterior wall, aponeurosis of all three flat muscles of abdomen. Aponeurosis of transverse and internal oblique are fused, but the external oblique aponeurosis remains separate. Posterior wall, it is deficient. Rectus muscle, fascia transversalis. Content: muscles, rectus abdominis and pyramidalis. Arteries, superior epigastric artery, intersheath by passing between costal and xiphoid. Inferior epigastric artery, intersheath by in front of arcuate line. Vein, superior epigastric vein and inferior epigastric vein. Nerves, terminal part of the lower 6 thoracic nerves. Functions: check bowing of rectus muscle during contraction and maintain the strength of anterior abdominal wall. Clinical anatomy: epigastric hernia. When intra-abdominal pressure is excessively raised, a amount of extraperitoneal fat may protrude through the upper part of the linea alba and eventually may drag behind it a small peritoneal sac which may contain a portion of greater momentum, forming epigastric hernia. Common types of hernia in females: epigastric hernia, lateral hernia, inguinal hernia, umbilical hernia, incisional hernia, and femoral hernia. Here it is the skin, abdominal muscles, and this is the loop of intestine, hernial sac, subcutaneous fatty tissue, and this is the peritoneum. Thank you.